see the topic of combined effect of drugs. So what happens if two drugs or two or more drugs are combined together and a medication is given? So if we give any combination, so if in a disease or in a medication we have to combine two or more drugs, so what happens? So we can observe three effects. One is that the drugs do not interact with each other, or else they show their own effect. So if we are combining two drugs, it shows, for example, it shows an analgesic effect and it shows the antihypertensive effect. They don't interact with the efficacy of both their effects. And the other one is they may show the synergistic effect, in the sense, for example, if we take the beta blockers, we are giving with calcium channel blockers. So these two are used in antihypertensive effect. So these have same action and these have same action, and thereby they are potentiating the effect. They are showing synergistic effect, additive to the effect what they have to show. The other one is they may show quite similar opposite actions. So one drug will show the opposite action to the another drug, thereby the effect is zero. So that this is called as antagonism. So these are the three effects can be seen when we combine any two drugs. And if we see the types of these effects, so what are the types of these combined effects are? We can see the synergism and the other one is antagonism. So what is drug synergism? So drug synergism is nothing but 1 plus 1 is equal to 3. That is, in the sense, if we are combining two drugs, instead of showing 100%, they are showing more than the effect what they have to show, or else they are showing more than the effect what the net result is. So here this drug synergism is of two types again, that is additive effect and the other one is supra-additive effect. Additive effect is nothing but 1 plus 1 is equal to 2. That is, they are showing double the effect they have to show. The other one is supra-additive effect, in the sense 1 plus 1 is equal to 3 or 4. They are showing more than the effect what they have to show. And this is the graph where we can see the activity of the drug when concentration is increased. So in the initial concentration, what is the effect shown by the drug? And if the concentration is increased, what is the activity or what happens to the efficacy of the drug? So here we can see the blue coloration indicates the fully agonist. In the sense, it is showing the efficacy of the drug. It is showing its action. And if we see the red coloration, that is partially agonist. In the sense, it is not showing its efficacy up to the mark. So the efficacy of this drug is little inhibited by various mechanisms. So here the partial agonist activity is decreasing when compared to the fully agonist, because this partial agonist activity or mechanism by which it is acting, that is inhibited by the inverse agonist or the antagonist. If we see here, the drugs which are showing the synergism, it has various effects. If we see, these are of various types or various categories. One is full inverse agonist. Full inverse agonist, in the sense, if we are giving one drug and agonist is given to the another drug, it is completely reversing the action. See, if agonist is given to agonist, plus and plus are given, then that should show double effect. Instead of showing that, the drug effect is reversed. It is completely antagonized, and the other one is partially inverse agonist. In the sense, the activity of the other drug is reduced a little when compared to the fully inverse agonist, and the other one is silent antagonist. Silent antagonist is nothing but it will not show any effect, neither increased effect or decreased effect. So that is the reason its effect is 0%. And partial agonist. Partial agonist is the one which potentiates the action of the drug little more. And fully agonist is the one which potentiates or show the efficacy or additive effect of the drug which is given into. And super antagonist is that which shows more than the effect what it has to show. And here this if we see, this synergism is of two types, additive and supra-additive, additive or summation. So if we see, if we are combining two drugs called A and B, effect of A and effect of B. So these are added up and the result is shown as the efficacy. And the final effect is that the summation of the individual effects. And here in this type of synergism, mostly the side effects are not observed. And if we see the example of summation, if we see the example of what is summation, what is addition. So here, if we are combining two drugs with different mechanism of actions. So if two drugs are there, different mechanism of actions, how they are showing the additive effect. For example, if we take aspirin, it inhibits the prostaglandin synthesis and thereby it is showing, or else it is showing the effect of analgesia. It is reducing the pain. And if we take codeine, codeine is acting by another mechanism called opioid agonist, and it is binding to the opioid receptor, and thereby it is reducing the pain. So mechanisms are different, but the result is the same. So if we combine these two drugs, the analgesic activity is increased. And if we see the example of addition, these are the drugs which activate same mechanism of action. For example, if we take ibuprofen and as well as paracetamol, these two drugs, they inhibit the prostaglandin synthesis, and thereby they are reducing the analgesia. So if we are combining these two drugs, they also increase the analgesic activity. So the net result is same, but this net result may be because of different mechanism of actions or because of the same mechanism of action of the drugs. And if we see the examples of additive effect, so if amlodipine is combined with atenolol, it shows potentiation, or else it shows a better result in as an antihypertensive. And the drugs like glibenclamide, when it combined with metformin, it shows a better hypoglycemic effect. And let us see supra-additive effect. So here in the additive effect, we saw effect of A plus B is equal to effect of A plus effect of B. But here effect of A plus B is greater than the effect of A and effect of B. So here the greater or else more effect is showed if we combine the two drugs. So if we take the example, the sulfamethoxazole and trimethoprim. So when these two drugs are mixed, then they show more action than what they have to show. So that is called supra-additive. Supra, more than the addition. So more than the addition, the effect is observed. If we see here the example, the enzyme called as dihydroteroate diphosphate, when it is combined with PABA, that is para-aminobenzoic acid, it is converted to dihydroteroic acid with the help of an enzyme called as dihydroteroate reductase. So this enzyme is inhibited by the drug sulfonamides, and this dihydroteroic acid is converted to dihydrofolic acid, and this dihydrofolic acid is converted to tetrahydrofolic acid in the presence of an enzyme called tetrahydrofolate reductase. Here the drug trimethoprim, it inhibits the enzyme called dihydrofolate reductase. So here these sulfonamides are initially binding the formation or initially inhibiting the formation of dihydrofolic acid, but this time trimethoprim, it is inhibiting the formation of the tetrahydrofolic acid. So the pathway is same, but the steps where they are acting is different. So if we combine these two drugs, they show supra-additive effect. How? In the sense sulfonamides block the initial stage, and if at all dihydrofolic acid is formed, then this trimethoprim, it inhibits the formation of tetrahydrofolic acid. Thereby they are showing more effect than they have to show. If we see the combinations or examples of supra-additive effect, here the acetylcholine, if we combine with physostigmine, then it will inhibit the breakdown of acetylcholine. And adrenaline, if we combine with cocaine, then it will inhibit the neuronal uptake of the adrenaline. And if we give tyramine with MAO inhibitors, that is monoamino oxidase inhibitors, they increase the CAD store, in the sense they increase the catecholamine storage. So the other form is that drug antagonism. Drug antagonism is nothing but which is showing the reverse action to the drug. So if we see combined effect of two drugs is less than the sum of individual. So here effect of A plus B, if we are combining A is one drug, 2 is one drug, we are combining these two drugs, then the net result is less than what they have to show. So if these drugs, if they combine, they are showing 100% effect. If these drugs individually are showing 100% effect, if we combine, they should show 200%. Instead of that, they are showing less than 100%. So they are showing less than what they have to show. Because that one drug decreases the effect of other drug, or else one drug will reverse the effect of other drug. So that is the reason this net result is observed. And if we see the types of antagonism, there are various types like pharmacological antagonism, which is further divided into competitive antagonism and non-competitive antagonism. The other one is chemical antagonism, physiological antagonism and physical antagonism. So pharmacodynamic antagonism. So here if we see the classification, the pharmacodynamic antagonism or else pharmacological antagonism is classified as competitive and non-competitive. So this competitive is furtherly classified as reversible competitive and irreversible competitive and pseudo-reversible competitive, and non-competitive is further divided as which interferes with downstream events or which act at the allosteric site. So if we see the examples or if we see different types here, the NMDA receptors. Let us take the example of NMDA receptors. So here the glutamate, normally the glutamate will bind to the glutamate receptor which is present on the NMDA side and thereby it exerts its actions. But if we say the competitive antagonist, it won't allow the glutamate. It is competing with the glutamate and it is not allowing the glutamate to bind to the glutamate receptor. Instead of that, the antagonist is binding. Here the same way with glycine side also. And if we say non-competitive antagonism, so here we have two different sides. One is binding side, the other one is allosteric side. So here the drug will bind to its site and the antagonist will bind to the allosteric site, whereby because of the binding of antagonist to the allosteric site, it won't allow the drug to show its action. So here the drug as well as antagonist are not competing with each other. They are binding at their own site, but action is the same. The antagonist is not allowing the drug to show its action. And if we see the competitive antagonism, here the drug as well as the antagonist, they are competing with each other for the receptor. And thereby they are not showing any effect, because instead of drug the antagonist binds and the antagonist is not having any effect, and thereby the net result is 0. And this antagonist, it binds to the same receptor, replacing the drug place. And here this if we see the examples of these drugs, the atropine and acetylcholine. So this atropine and acetylcholine, they bind for the muscarinic receptors. So here the atropine is the antagonist for acetylcholine. So it won't allow the acetylcholine to bind to the muscarinic receptor. And naloxone and morphine. So morphine, naloxone, it won't allow the morphine to bind to the opioid receptor. And because of that, here if we see the antagonist is binding to the receptor, right? If we increase the agonist concentration also, there is of no use. So here if we take an example, one molecule of agonist is there, that is drug is there, and antagonist came and replaced its sites. For example, if we give 3 molecules, that is we are increasing the concentration of drug, even though that is of no use, because the agonist can't displace or it can't remove the antagonist from the receptor and it go and bind. And if we see the graphical representation here, green molecules are agonists. So normally agonist will come and it binds to the receptors and thereby the action is observed. And if we see the red molecules are antagonists. So if we inject antagonist, so the antagonist will come and slowly it binds to the receptor. And as the concentration of antagonist increases, it is binding to the receptor more. And if we see here, when compared to previous slide and this slide here, the antagonist, it is removing the agonist from its place, and in the sense it is competing with the agonist and it is taking the place of the agonist. It is not allowing the agonist to bind to its site, and thereby if we see the antagonist, it is replacing the site of agonist completely and it is not allowing the agonist to show its effect, and thereby if we see the blue coloration graph, the activity of the drug is decreasing. So as the agonist, it completely binds to all sides of the receptor, the action is 0. The agonist action or the drug action is 0. If we see the non-competitive antagonism, here the agonist, it binds to the different site of the receptor. So this binding is irreversible. So once the agonist binds to the another site of the receptor, the action cannot be reversed. And thereby here if the antagonist, it is bind to other side and agonist is binding to its side, then this antagonist, it will not allow the agonist to show its action, and thereby the agonist can't show its action. So that this is called non-competitive. So this here, the agonist and antagonist, they are not competing for single site. They are having different sites, but It is not allowing the agonist to show its action. And if we increase the concentration of agonist also, it is of no use. They are having two different sides. If we increase the agonist side also, here the antagonist, it won't allow the agonist to show its action. So this type of antagonism is called surmountable antagonism. So even though if we increase the agonist concentration, the action or efficacy of the agonist is not altered and the action is irreversible. And if we see the examples, the drugs like phenoxybenzamide and epinephrine at alpha-1 receptors. So this phenoxybenzamide, it binds to alpha-1 receptors, and as well as epinephrine also binds to the alpha-1 receptors. But the action of epinephrine is not observed. And the other one is phenoxybenzamide is the drug of choice in pheochromocytoma. So this is an additional advantage in this drug. In the sense, if we give the phenoxybenzamide in pheochromocytoma, because this phenoxybenzamide, it shows better action when compared to epinephrine, and thereby it shows better effect to treat pheochromocytoma condition. If we see the chemical antagonism, so the other type of antagonism is chemical antagonism. So chemical antagonism is a type of antagonism where the drug encounters the effect of another by simple chemical reaction. So here one drug effect is altered, or else if we give two drugs, this drug is affecting the action of other drug with some small chemical reaction or neutralization reaction. So if we see the chemical antagonism, so what are the various chemical antagonism means? So two drugs, when they combine with each other, they form inactive compound. So we are giving two drugs, they are undergoing chemical reaction and they are forming inactive compound which is of no use. And the other one is, if we combine two drugs, they are forming active compound. So if we, because of the chemical reaction they are getting, they are forming an active compound which is of desirable effect. And if we combine two drugs, they form compound which is water soluble. So because of the chemical reaction, they are forming a drug which is water soluble that can easily distribute all over the body, but it cannot cross plasma membrane. And the other drug is that because of the chemical reaction, they are forming a compound which is fat soluble and that can be easily crossing the plasma membrane. And if we see the example of this chemical antagonism, the drugs like sodium hydroxide, in the sense the reaction between sodium bicarbonate and HCl. So sodium bicarbonate and HCl, one is acid and the other one is base. So when acid and base are mixed together, they form a neutralization reaction. So here the sodium chloride is formed and water and carbon dioxide are eliminated. And protamine sulfate and heparin. So if we take the example, protamine sulfate and heparin. So protamine sulfate, it is a basic compound and heparin is an acidic compound. So protamine sulfate is an antidote in heparin poisoning, because this protamine sulfate, it reacts with the heparin and thereby it is not allowing the heparin to show effect. So if there is any overdose of heparin, if we give protamine sulfate, it will nullify the effect of heparin and thereby preventing the heparin poisoning. And the other one is dimercaprol. So dimercaprol is a chelating agent, and if we give it arsenic, it prevents from arsenic poisoning. So dimercaprol is a drug of choice in arsenic poisoning, because this compound, this chelating agent, it will combine with arsenic. The other one is physiological antagonism. So if we see physiological antagonism is nothing but it is a type of antagonism in which the drug opposes or reverses the effect of another drug by binding to different receptor. So here one drug is opposing the another drug. So if we take in a receptor, we have different binding sites. So one drug is binding to one side, the other drug is binding to another side, and they are showing the reverse action by physiological effect. So if the physiological effect of the drugs are altered and thereby they are not showing any effect, so such type of antagonism is called physiological antagonism. If we take the examples of physiological antagonism, here the histamine and adrenaline. So histamine will bind to the bronchial muscles, as well as the adrenaline also binds to the receptors on bronchial muscles, and thereby they are affecting the blood pressure, which is the physiological activity. And glucagon and insulin, so they also bind to different sides of the receptors, and thereby final result is that they are affecting the blood sugar level.